The cosmetic industry is a vast industry. My wife uses a significant amount of cosmetics. Like most women, she uses makeup. And makeup by itself can potentially improve one's appearance. They are not treatments for wrinkles, however. There are some products, some creams that have been shown in lots of publications to improve wrinkling, and the product that's most with the most evidence base is a product called Retin A, which is actually present in a lot of cosmeceuticals, so a lot of cosmetic industry, but at very low dose. You can increase the dose of the Retin A, and that will improve patients' skin in terms of tightening up the skin and reducing wrinkles. And there's a proven benefit from that. But when you get to that type of strength of preparation, it becomes a prescription-only drug. It's not something that is freely available in a sort of the department store. It's something you'd need to go to a specialist and get advice about. And associated with that type of product, there are a variety of skincare ranges which do appear to be beneficial for patients, sometimes to help maintain the result of surgery. So for instance, following a facelift, you might wish a patient to go on to various Retin A-based preparations. I better not mention brands by name, but there are various brands out there which provide that, and that can be beneficial in maintaining the patient's skin. Botox and fillers have completely really different aims. Botox is a treatment for what are called dynamic wrinkles. So when I frown, I get little lines there. When I raise my eyebrows, I get line there. I get lines there. That's really where Botox scores heavily. And those lines, those laughter lines that we get are signs of aging, and Botox will treat that extremely successfully. Dermal fillers are used for contour defects. So for instance, if you've got folds that are becoming deeper here, there, sometimes folds that are, or troughs that are deeper there, that's where dermal fillers can be used very successfully to treat those areas. So they're rather different in what they're aiming to do. They're not treating the skin, they're treating contour anomalies or dynamic lines. The danger of products that clearly appear to work when you first apply them is they may be working in a slightly different way. They may be camouflaging or providing a lining on the skin which is itself tightening up, but is not going to provide a long-lasting effect. There is very little evidence to suggest, other than the non-surgical treatments that we've talked about, i.e. the Retin A's, the Botox and dermal fillers, that any of the cosmetic creams have any effect on wrinkles. And a lot of people look at these and research them quite heavily. The effects, if they do occur, are very subtle and will not be long-lasting.